Welcome to the third part of this lecture series. For this third part, we will talk about the thoracic cavity. Now, if we open the chest wall, okay, we will discover that the thoracic cavity is actually divided into three compartments. Okay, you have a median compartment, this one, the one colored in green, known as the mediastinum, which houses the heart. Okay, the vessels that carries blood from the heart to the other parts of the body, as well as the vessels that brings blood back to the heart. So it also contains the trachea, okay, and the esophagus, okay, the nerves that supplies the diaphragm, such as the phrenic nerve. Okay, it also contains the vagus nerve. Okay, lateral to the mediastinum are two other lateral spaces known as the pleural cavity, the one colored in blue. And you will notice here that the pleural cavity assumes similar to that of the shape of the thoracic cage. It has a conical shape, okay? It has an apex, this one, okay? Uh, it has the surface that faces the inner wall of the ribs is known as the costal surface. Okay, that surface that sits over the diaphragm is known as the diaphragmatic surface, and the surface that faces the mediastinum is known as the mediastinal surface. Now, the pleural cavity is actually lined by a thin serous membrane, okay, known as your parietal pleura, this one, okay. Okay, this is the parietal pleura. Now, the parietal pleura has different surfaces depending on what part of the pleural cavity that it lines, okay. The part of the parietal pleura that lines the inner surface of the anterolateral and posterolateral uh, chest wall is known as the costal surface. This one, okay. That okay. The part of the pleura that dips, okay, and reflects over the diaphragm. This one is known as the diaphragmatic surface. Okay. Okay. The one that lines, okay, the lateral border of the mediastinum is known as the mediastinal uh, surface. Okay. The parietal pleura, by the way, has an apex which extends about 1 to 2 centimeters above the upper margin of the first rib. Okay, that part of the pleura that extends, okay, over the margin of the thoracic inlet is known as the cervical pleura. Okay. Now the parietal pleura, okay, eventually, okay, meets with another layer of the pleura known as the visceral pleura. The visceral pleura is the part of the lining of the pleura that wraps around the lungs, okay, up to the root of the lung. This is the root of lung. The root of the lung, by the way, is that portion that contains the blood supply, venous drainage, as well as the uh, airways of the lungs. Okay, it is actually a bundle of structures made up of bronchus, the pulmonary artery, pulmonary vein, the bronchial artery, and they are wrapped, okay, by a layer of parietal pleura, and that bundle of structure is known as the root of the lungs. Okay, okay, this is the diagrammatic representation of the lining of the pleura, okay, which is made up, as we mentioned a while ago, of two layers: the parietal pleura, okay, that one that lines the inner surface of the pleural cavity, and the parietal pleura and the viscera. So the visceral pleura, this one, it lines the the lungs, both the apex, the costal surface of the lungs, okay, the basal surface of the lungs, the mediastinal surface of the lungs. Okay, it meets its counterpart. It meets the parietal pleura at the area of the root of the lung, over this area. Okay, this is the root of the lung. Okay, the part of the lungs, okay, where the structures of the root of the lung will penetrate into the lungs, okay, is known as the hilum of the lungs. If you notice, the parietal and visceral pleura is actually forms a closed membranous sac, okay? And this closed sac, this space in between the parietal and visceral, enclosed by the parietal and visceral pleura, is known as your pleural cavity. It is actually a potential space which is filled up with a minimal amount of pleural fluid, which acts to lubricate, okay, the surfaces of the lungs and the parietal pleura, in order that there would be minimal frictions between the two, okay, during respiratory movement. Okay. Uh, the reflection of the parietal pleura, okay, over the diaphragm, okay, and over the diaphragmatic pleura and over the mediastinal pleura create deep crevices or recesses known as your costodiaphragmatic recess, this one, okay, and the costomediastinal recess over here. Okay, these are area spaces in that are areas where blood fluid can potentially collect. Okay, so that is the uh, area of the root of the lung. By the way, the lung actually is totally suspended within the pleural cavity. It is only supported by the root of the lungs. Okay. So this is the extent of the parietal pleura. Okay, this is the costodiaphragmatic recess. Okay, this is the costomediastinal recess over here. Now, the costodiaphragmatic recess actually extends anteriorly going posteriorly. Okay, it is much shallower anteriorly, and the costodiaphragmatic recess is much deeper posteriorly because the posterior thoracic wall is much longer as compared to your anterior thoracic wall. Okay, so this space here gives the lungs certain degree of allowance in order for it to expand during inhalation. Okay. Now, anteriorly, the parietal space, the pleural space, can go to as low as the level of the eighth rib anteriorly, eighth intercostal space, but sorry, and laterally it can go as deep as the ninth intercostal space. Okay, okay, and posteriorly it can go as deep as the 12th level of the 12th rib. Okay, so this is the extent of the costodiaphragmatic recess. Okay, this is where usually blood can collect if there is an injury to the lungs, or pus if there are infection of the lungs such as pneumonia, or serous fluid. Okay, can also collect in here. Okay. Okay, so these are the different pleural recess. This is the costomediastinal recess. This is the costodiaphragmatic recess. Okay. Okay, we will go to the cadaveric specimen. Okay, in here we have opened up the thoracic cavity. So this is the mediastinum over here. This is the right pleural cavity, left pleural cavity. This is the diaphragm. This is the anterior chest wall. Okay, showing us the inner surface of the sternum. Okay, this, sorry. Okay, this is the uh, costodiaphragmatic recess over here. This is the costomediastinal recess. Okay, this is the lung, right lung inside too. Okay, this is the pericardium. Okay, or the membranous sac which covers the heart. Okay, this is the parietal pleura over here. This one. Okay, this is the visceral pleura which is tightly adherent to the lung parenchyma. Oh, sorry. Okay, this is the uh, internal surface of the anterior chest wall, showing us the innermost intercostal muscle. Okay, this over here are the course of your internal thoracic artery and vein. Okay, that one over there. Okay, this area here, this is the costal pleura. That one. Okay, that one. This is the costal pleura, which is part of the parietal pleura. Also, So the part of the parietal pleura that uh, lines the inner surface of the ribs, this one, that one, this one. This is the costal parietal pleura. Okay, that's the thymus gland over there. Okay.